Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Hello there. Good afternoon. We are glad that you're watching your favorite health talk show, the Doctalk Show, with your host, Dr. Joseph Ogavu Jagenda. Are you aware that Uganda is a very young population, with up to half of our people being below the age of 15? Are you aware that over the years, our country has made so many gains regarding the prevention of preventable diseases? We are talking diarrhea, we are talking pneumonia, we are talking tuberculosis, measles, polio, among so many others that we used to sing, if you remember, in primary about those immunizable diseases. And being in the month of October, the Ministry of Health, as we know, arranges what we call integrated child health days that are held in the months of April and October. And needless to say, we are in October and we are yet into another month. And the ministry is set to drive the campaign to vaccinate about half of the young people in this country. Joining me today is a very important person for the Ministry of Health, Dr. Alfred Ddiwali. I'm glad to host you. You're welcome.
Thank you.
The viewer wants to know, who is Dr. Ddiwali Alfred?
My name is Dr. Ddiwali Alfred. I am Assistant Commissioner in charge of vaccines and immunization in the Ministry of Health. And I also head the program, the national program for immunization.
I see that we have a very big and important person regarding our health. What does your duty really entail, especially in regards to vaccination?
The Ministry of Health, as its core function, exists to guide health promotion, disease prevention, treatment, and rehabilitation of health. Now, as immunization program, we also exist to reduce morbidity, illnesses, or deaths, or disabilities, which are caused by diseases which are otherwise preventable through vaccination. So our work is to ensure that we plan, we mobilize resources, we build the capacity of the healthcare system, we build we train healthcare workers, we implement the standards which are set, and we supervise. So this is what immunization work, which is done in the local governments. So that is our core function as a program, and that is it.
So is it really true that much of what inflicts pain and infirmity on Ugandans can actually be prevented? Is it possible to prevent disease, or you should just wait to treat it? And is cancer even preventable? Are some of the cancers preventable?
Yes, as I had stated from the beginning, diseases can be prevented by good action on things which determine health. Through good eating, good accommodation, good hygiene, exercise, good seeking of knowledge, early health-seeking behavior. All these impact on your health, so you can prevent diseases at that level. That is at health promotion level. The second is when the diseases are imminent, you also take measures to avoid. For example, now we have COVID.
Yes.
And when you wash your hands, you wear a mask, and you maintain social distance, you are now preventing the disease. And as we may see in near future, you can also give vaccines to prevent a disease before it strikes you. And once now the disease has affected you, then you go on treatment. The treatment will have two outcomes. Either you improve
Yes.
or you succumb.
It's a reality
Now,
of life.
once you succumb, that's the end of the story.
Yeah.
But when you recover, you may recover with sequel. Then an effect which remains with you forever. And that is where the effects will require rehabilitation. So diseases can be prevented. And also diseases which are prevented include infectious diseases, non-communicable diseases, where the cancers, the diabetes, the high blood pressure, they fall.
So by communicable, you mean that by being close to you or sharing so many things, including intimacy, one can be able to pass on disease from you,
yes,
and vice versa.
These are diseases which generally are caused by disease-causing agents, and they move from one person to another. So, yeah, like malaria, like HIV, like COVID.
And what diseases are we talking about that we are targeting to prevent in Uganda? I know we have conditions that affect the lungs, some affect the skin, some affect the brain, and they cut across pregnant women, children, the old. Which diseases are we trying to target, especially during this drive?
So in Uganda, our immunization program has grown over time. From 6 killer diseases, now we are talking of 12 diseases. And you can see that now we can prevent diarrheal diseases, diarrhea which is being the second reason for hospital attendance, and also one of the leading causes of death, can now be prevented in childhood by vaccination. We also have 2 vaccines which prevent pneumonias. Pneumonias have been the second reason, second reason ahead of diarrheas, which is third, as the reason for hospitalization and admission. There are 2 vaccines we provide to prevent that. And also diseases which affect the throat, the diphtheria, pertussis. These are diseases which the younger generation may not know, but previously it would cause a bag of pus in your throat, swelling of the neck, you fail to breathe, or you aspirate the pus, and death would result out of that. We also have measles and rubella. Measles, I think it is common knowledge, but there is also a generation who do not know it now.
And I'm one of those, actually. I missed my first case of measles, and it was seen by my senior. And
yes,
I had every reason not to know it, because I had definitely never seen.
It's because of vaccines. Then also tetanus, which kills normally newborns who are born under unhygienic conditions, and also mothers following labor. Tuberculosis is another one of such diseases. And this is a disease which will be with you for a long time and damages the lungs. You may cough blood, you lose weight. It can also go into your brain, into your neck, lymph nodes, and so on. So this is another very severe disease. Vaccines are actually helping us prevent those severe forms.
In fact,
we
are taught that tuberculosis is a masquerader. If we were in school and your senior asked you a question and you fail to find the cause, you would say TB.
TB.
and you'd really pass with flying.
Because it affects almost all organs.
Yes.
So you will be right whichever direction you go.
Definitely.
Yes.
So the Ministry of Health and government at large has put a lot of effort in vaccination, and we are really in high gear. There's so many campaigns annual. If you look at our history, and since we got into these big drives for vaccination, are we making big gains? How has the country benefited?
So I think we are silently making groundbreaking gains in our fight against vaccine preventable diseases. I have not even added diseases like leprosy, diseases like polio, to other cancers which are preventable, cancer of the liver, cancer of the cervix. I have not added the list, so the list is long. Now, why we are insisting on vaccination is one of the most effective public health interventions, which produces immediate results at a lower cost. and you can reach many people with these interventions. So if you want to look at the impact of immunization, look at if you look at the numbers of our history. By 1988, of every 1,000 babies born alive, 100 would have died before they reach 1 year.
So that's 1,000. A
Out
tenth.
of, yes, a tenth. But as we speak now, of every 1,000 babies born alive, at least by the time you reach, you check them after 1 year, only about 40 will have died.
Very big gain.
So this is a very big gain. And this big gain is translating itself into increase the life expectancy at birth. Now, when you produce a child, you can be certain that about this child can reach 63 years of age. But if you wind the clock backwards, around 1990, you would only say, oh, maybe you'll reach 45 years. Yes. But now you can be certain that this child will reach 63 for most of the people.
Thank you very
so
much,
this is again.
Dr. Ddiwali. You remind me of the days when women would tell you that, Doctor, I'm not so sure whether this child of mine will survive, so I must produce many followers just in case the others do not make it. We are glad that we have many ways that can save us having to play a game of numbers.
But look, from where I come from, most names of children bear death in it.
Oh, yeah.
Drani, Dratele, Buni, Butia, and so on. All
Chandia.
These names, Chandia,
Yes.
These are names, Drani, Dratele, Butele, or Drajia. All these are names which are telling you all of them have died. This one is waiting for a turn to die, and so on. It depicts the high infant mortality rate. Oh, yeah. And if you go to those communities which used to name like that, you begin to see change in the pattern of naming. Yes. People are now giving love, lucky, yes, and so on. So this is telling you that through efforts to reduce unnecessary deaths of children, the communities have hope. And you can see the hope in the nomenclature, the names they give their children.
Thank you very much, Dr. Alfred, and thank you, viewer, for sticking to the Doctalk Show. As you take this short break, stay tuned and send us your questions. We shall be glad to answer them. And we are glad that you're following us on our Twitter, Facebook pages, as well as subscribing to our YouTube page. I see you soon.
You are watching the Doctalk Show.